So before I walk in the room, I will check if the patient is on any type of precautions. Then I will walk in the room. I will assess for any environmental hazards, anything potentially hazardous for us. We'll perform hand hygiene. Hi, my name is Justin. I'm going to be your student nurse. We're going to be performing a bedside assessment on you. Can I have your name and your date of birth?
Sarah Hinkey, July 22nd, 1996.
And do you know where you are?
John Tyler Hospital.
And do you know what day it is?
It's Thursday.
Okay, so the patient is alert and oriented ×3. She appears to have adequate hygiene, a relaxed body posture, and calm facial expression. Are you in any pain today? No? So we would rate that as 0 out of 10 on the pain scale. And if she wasn't in any pain, we would assess by using the mnemonic old cards. We're going to go ahead and take her vital signs. We're going to do blood pressure, O2, temperature, heart rate, and pulse. Okay. The patient is making good eye contact with me. She's had clear and logical speech. Have you had any difficulty swallowing lately? No. Okay, we're going to go ahead and test her pupil reaction. Pearl is intact, meaning pupils are equal, round, and reactive to light and accommodation. The pupils are 3 millimeters in diameter. Can you feel me touching here? And what about here? Alright, she has all sensations in her extremities. And now we're going to move on to her respiratory system. For this purpose, we're going to go ahead and say when we took her respiratory rate, it was 16, which is normal. Her breaths are even and effortless. I'm going to go ahead and auscultate her lung sound, starting with the anterior, going to posterior. All normal lung sounds are heard. There are no wheezes or crackles. Okay, I'm going to check her for signs of cyanosis or clubbing. There's no cyanosis or clubbing. And while I already have her here, I'm going to check her capillary refills. It is less than 3 seconds, so she is good. Can you cough for me? Patient has a non-productive cough. If it was productive, we would check for color and amount of sputum. We're going to go ahead and do her cardiovascular system now. I'm going to start by listening to all of her heart sounds with the diaphragm of the stethoscope. We'll start with aortic to pulmonic, tricuspid, and mitral. We're going to turn over to the bell of the stethoscope to listen to any low-pitch sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Now we're going to go ahead and listen to her apical pulse for 1 full minute. S1 and S2 sounds are heard. There are no S3 sounds, regular rate and rhythm with the S1 and S2 sounds. We're going to compare her apical pulse to her radial pulse. Right, and there's no pulse deficit noted. I'm going to go ahead and compare both radial pulses bilaterally. Right, and they are equal at +2 in strength. Alright, so we're going to check for any signs of pretibial edema, and there are no pretibial edema noted. We're going to palpate the dorsalis pedis pulsus. Right, and they are at +2 bilaterally. We're going to palpate the posterior tibial pulses. And both of them are at +2 bilaterally. Right, and while we're already down here, we're going to check for the warmth of her lower extremities, and they are warm. Her upper extremities are warm. So overall skin temperature is warm. It is pink and appropriate to race. It is dry and intact. There are no lesions noted.
Is that good enough?
She has elastic skin turgor. Okay, now we're going to check for symmetry of her body, starting with the face, moving down to the extremities, and she is symmetrical. There are no deformities noted. Now we're going to test her muscle strength, starting with her upper extremities. Can you grip my fingers? Right, let go. Can you push my hands down?
Sorry.
Can you push my hands up?
That's good.
All right. Can you push my hands down?
Yeah.
Now push my hands up. All right. She has a 5 out of 5 muscle strength in both the upper and lower extremities. And we're going to check her range of motion. In her lower extremities, can you bend your legs for me? All right. Come back down. All right. Can you lift your arms up? And then cross them over your body. And then you can come back to your sides. She has full range of motion. She looks to be well nourished. She has a flat contour to her abdomen. I'm going to go ahead and auscultate her vowel sounds, starting with the right lower quadrant and working counterclockwise. Okay, vowel sounds are heard in all 4 quadrants. Have you had any problems tolerating your diet lately? No? Have you been able to pass gas or problems with stool at all?
Yeah, no problems.
No problems. When was your last bowel movement?
This morning.
Okay, good. Sounds good. And with urinating, have you been able to urinate regularly? No pain or burning? All right. And if we had a sample, we would check for color, clarity, and amount. So if my patient was on bed rest, I would be turning her every 2 hours. Since she's not on bed rest, if she wanted to transfer to a chair, I would assist her in that transfer. I would assess her toleration of the movement and any assistance that she needed. If she did need any kind of assisting devices, I would make sure that those were in the room, such as a bedside commode or a walker. If my patient was on an IV, I would assess what type of fluid her IV was and the flow rate, and make sure the flow rate matches what the doctor has ordered. I would check the site and make sure that there's no signs of infiltration or edema. Or erythema, sorry about that. If the patient is on oxygen, I need to check what type of oxygen, whether it's a nasal cannula or a Venturi mask. I will check the flow rate of it, make sure that matches what the doctor has ordered. I will also assess the placement of the oxygen, making sure that is in the right place and there's no breakdown of the skin. If my patient has any drains or tubes, I'm going to also assess them. And if my patient has a catheter, I'm going to check to make sure there are no kinks in the tubing, find the location of the catheter and make sure it is secured, whether it's on the leg or the bed. I'll also go ahead and check the color, clarity, and amount of the urine in the catheter bag. And if my patient has any dressings, I'm going to make sure they are dry and intact. And if she has any SCDs or foot pumps or TEDs, we're going to make sure that they are secured on properly. Once I am done with my assessment, I'm going to go ahead and lower the bed to the lowest position. I'm going to make sure that the brakes are locked and make sure the appropriate side rails are up. I'm going to verify that the call bell is in reach and that if indicated, I'm going to verify that the bell alarm is on. And at the end, I'm going to document my findings.